A lot of people like turkey, but nobody likes that turkey neck. You know what I'm talking about? The hanging, the sagging. Here to help us get rid of all of that without going under the knife is board-certified dermatologist Dr. Melanie Palm from the Art of Skin. So first of all, let's talk about some common problems that a lot of people face when it comes to their neck, because a lot of times our age shows in our neck.
Absolutely, you're totally correct. So there's several things that happen. We get a little bit of crepiness, so there's a textural change over time. We start to get sagging, so we lose that pretty contour that's right underneath our chin. And then we can get banding as well. So we've got a big muscle called our platysma that starts to separate a little bit. But the first two issues we can actually address with a machine that we have here today called Ultherapy.
So tell me, if you would, a little bit about Ultherapy. We actually have a video to show. We'll go ahead and put that up, and you can kind of talk about a little bit about how it works.
So Ultherapy, it's an ultrasound-based system. You can see it's actually firing there, and it micro-focuses down to connective tissue layers that surgeons take when they're doing a facelift, a brow lift, or a neck lift. And in this way, it heats up those little micro-focus zones, and then over a period of about 3 to 6 months, it actually tightens the tissue and causes lifting. So it's considered a non-surgical alternative to things like facelifts, brow lifts, or neck lifts.
Interesting. And so we're looking at it actually sort of working right here on the skin.
That's right, and so it actually bypasses the skin. That's a really neat thing. When we actually demonstrate it on the patient, you'll see it doesn't affect his skin in any way, but it actually sort of bypasses that and gets down to the depth that we predicate by the transducer that we're using.
Excellent. And we have a volunteer today.
Me too.
George?
Jordan. So we have a good-looking guy here named Jordan.
And Jordan, what do you want to work on? What results do you want to see?
Right, just tighten up the neck a little bit.
Is it something that's been bothering you for a while?
It has.
Okay, cool. And you've never done this before?
Have not.
All right, so let's get to it. Show us, if you would, how it works.
So I'm going to hit scan. So this is the transducer, and there's a couple different depths that we do. We do a deep one first, and then we follow that by sort of an intermediate depth. And then this scans it. So if you look behind me, once we actually turn that on, you're going to see his skin right behind me. And so we actually look at that on the top screen to make sure that we're targeting the right screen.
Over here?
Yes, that's correct. And then once we've found the exact area that we want to be in, I can see the skin well, we actually press. And it's something that I just do with a little bit of local numbing blocks. You know, a lot is talked about doing patients with a lot of pain medication, and I find people are really comfortable. Most of my patients usually fall asleep during the procedure.
Oh, really?
So it's really great. It becomes something that, you know, for a neck, it takes us about 45 minutes to do.
Okay.
It's relaxing. They get to listen to music, and sometimes we chat a little bit. And it's usually the nicest, quietest time of the day for patients, so they actually enjoy it. And we would just repeat that. You can see we've done a little grid on his neck. So we treat in the central area and then spread our ways across. And then over the next 3 to 6 months is really when he'd notice the tightening along that underneath the chin and along the jawline area.
Can you do one more and tell me, how many procedures do you need to usually do before you see results?
It is FDA approved as just a one-time procedure, and it lasts approximately 12 months. Now the study just went out to 12 months. It probably lasts a little bit longer than that. I think it probably lasts closer to 18 months, sometimes 2 years in some patients. So I tell patients this isn't, you know, a permanent fix. We continue to age, and so there is some maintenance required. Just like you would get a haircut or you'd change oil in your car, you need to keep up with your face as well.
What are we talking about price-wise to get this done?
Sure. So we're actually doing a nice little special. You know, the typical average price for this, for doing the neck, is around $2,500. We're running a special. If you do the face and the neck, we're doing the neck for free. Because it's Necktember, we wanted to celebrate the turkey gobbler and actually get rid of those gobblers, so the only one is on your turkey at Thanksgiving.
Let's show these before and afters real quickly.
So these are a couple of before and afters. We got a gentleman as well as a female, and you can see the before is actually the one below, and the after is above. And what you can see is tightening in that chin area, and even along what we call the mandibular sweep, or along the jawline, that often tightens and defines.
Excellent. Jordan, what did you think of it? What did it feel? Did it hurt?
No, I didn't feel anything.
Really?
Nothing.
You could almost go to sleep, huh? There
Yes,
were lights and a
absolutely.
camera on you, huh?
That's correct, yes.
Who is a good candidate for this? Who is not a good candidate for this?
So, you know, people that have real severe neck laxity probably will get some improvement, but aren't going to have a miraculous outcome. So I think somebody that's starting to get a little bit of that looseness underneath the neck, wants an improvement, maybe isn't ready for surgery or isn't quite there yet, this is a great alternative for that. You know, other patients, more significant laxity, I tell them we may want to do a couple, and if they're really against sort of doing some sort of surgical intervention like a neck lift, we can do this non-invasively and get some tightening. So really mild to moderate laxity in that
Are
area.
there any risks or drawbacks to this?
There isn't really. You know, there's a slight risk of getting a skin burn or getting a little bit of a bruise, but I'll be honest, in the time that I've been performing the procedure, I've never seen a skin burn and maybe a bruise once.
Okay, very good. We just put your information up there. You're located in Solana Beach.
That's
It's
right.
called The Art of Skin with Dr. Melanie Palm. Thank you for being here.
Thank you.
We appreciate it. Thank you, Jordan. You're a good sport. All right, let's send it back over to you now.